Okay, good morning, good afternoon, good evening for wherever you are joining this presentation. Thank you for joining me today. My name is Herbert Jelinek and I'm an associate professor at Khalifa University in the Department of Biomedical Engineering. My presentation today is going to be looking at the issues of mental health that are associated with COVID-19 pandemic, and then I'm going to talk to you a little bit about some of the work that we've done here at Khalifa University to address these mental health issues. So let me just now start my presentation by sharing my screen. And putting it on presentation. Okay, so mental health and COVID-19 in the UAE is basically what I'm going to be discussing today. And as you can see, there's a number of important collaborators, including and shown at the bottom of this slide. My presentation today will mainly be looking at the first of all, a personal experience by somebody who has had COVID-19. I'll have a brief look at some of the worldwide mental health issues, concentrating more or less on the MENA region. I'm looking at the UAE as well, and then I'm going to change tack a little bit and look at what has been done, what can be done, and then what we in fact are doing in the UAE, and a lot of that then will be based on what we can call biofeedback that can, well, I'll explain that to you, can help in ameliorating stress and anxiety and possibly improving immune function. So this is now a survivor account by Dr. Crosby, and you can read this for yourself. It says, she's experienced terrifying hallucinations, loneliness, and anxiety. She felt fear, anxiety, helplessness, hopelessness, low mood, and guilt. And, you know, how did she become infected, etc. And she says the toll of COVID-19 on mental health is compounded by quarantine, isolation, and uncertainty. And I think that's really the basis of what's happening now. You don't know who's carrying it. You don't know if you're going to get infected, where you're going to get infected, when you are being infected, and then in fact, how, if you are infected, how severely will you end up getting the infection. So these are all points that can lead to not just physical dysfunction, but also mental health issues. So here are a number of these that are outlined here. Impacts of COVID-19 on mental health. So what's happening here? So we have COVID-19 having an effect on mental health that leads to and is described as anxiety, depression, and stress by Salari et al. In 2020. And here we mention a number of these factors, so facing great changes and inadaptability. So we all need to adapt, you know, like wearing masks, social distancing, etc. Lack of physical and mental health knowledge, lack of psychological coping mechanisms. Again, many people in the population do not have enough mental health knowledge and certainly no idea about how they can change their behavior to cope with the psychological stresses that we have. The impact of social media. Again, I've talked about this in a previous presentation where we can see that the social media has a huge impact on people's mental health in that they sometimes concentrate on particular aspects of the news that is sometimes seen as promoting more stress than relieving it. Also, they do not always tend to give you correct information and all scientific validated information. Certainly then we have quarantine, so isolation If you're traveling, you need to be 2 weeks in isolation, or if you've been in contact with somebody, you have to be 2-week isolation, and that certainly then has other stresses and implications. And then there's fear and anxiety for health and the health of the family. Further, there's lack of infectious disease knowledge. So how does infectious disease actually work? Is it real? Some people may even ask. And then again, lack of health behavior. So this idea of washing hands, cleaning surfaces, not touching surfaces, being safe in lifts, escalators, etc. And economic problems. So if you're having to stay home because you can't work, because you've actually been in contact with somebody with COVID-19, or you've got it yourself, well, then you'll be losing out on income that then creates stress in terms of economic issues, and or you may have a small business similarly that had to be closed down, and we certainly heard a lot about that in the last year plus. So sleep patterns therefore can change, nutritional patterns change, and all of these then affect your mental health per se, and we all suffer, if you like, from that, and we need to be able to do something about it. And certainly the vaccination programs are here as part of this to help alleviate these stresses and make us, all of us, safer. So here, just briefly looking at a general picture of the global burden of disease in the UAE. So not just the mental health, but in general. And as you can see here in 2017, and this has not changed a lot, there's no current data that I could find, but we see that cardiovascular disease is on top of this burden of disease. Don't worry too much about the numbers, but just if you're looking at the graph, it's way out there. Then we follow with musculoskeletal disorders, transport injuries, cancers, and then we end up with mental and substance abuse disorders. So we're fifth down the line in terms of mental health. If you then add though self-harm, which is down here, if you add this, and then you add things like neurological disorders to it, respiratory disease, nutritional deficits, interpersonal violence, all of these things that are compounded in the COVID-19 pandemic, you end up exceeding cardiovascular diseases. And that is the issue that we're currently facing. Bringing things a little bit closer to home and starting actually, first of all, in Wuhan, this particular study here shows that 36.4% of people investigated, reviewed, had neurologic symptoms. 36.4%. So we'll bring this in context in a minute. Another Italian study showed that these included then 31% with stroke, 12% showed headaches, 9% showed seizures, and 4% showed dizziness. 59% reported an altered mental health state. And this is from a study of 725 hospitalized patients. Not all of it necessarily connected directly with COVID, but certainly there tends to be a much greater number or percentage that we see. This is also then shown in this table that I'm put up here on this slide. And again, you can see like stress in Europe, 31.9%. In Asia, it's been recorded as 28%. Depression again around the 30s, so Asia 35%, Europe 32%, and anxiety again in Asia 33% practically, and in Europe nearly 24%. So these are quite large numbers, and you can see this a little bit better here when I'm showing you now something closer to home, in fact the Saudi experience. And up here on the top left, I have the numbers for 2014 published by Al-Hadi, and they measured here, for instance, 13.4% with moderate depression, 4.4% with moderate severe, 1% with severe cases with depression. When I then look at the Almari paper, again from Saudi, in 2020, you can see that the depression has gone up, severe depression has gone up to 7%. And anxiety and stress are again around the 4% and 6% margin. So certainly 7%, much higher than 1%. And this is again reflected here in another Saudi study by Al-Hames, where again we can see severe depression at 7.1%. So that's very similar to the Almari finding. So that tends to be something that is definitely happening here, that more people are showing up with, certainly with severe depression, and in some instances certainly there's a rise in moderate depression as well. Another way of looking at this is shown now in this UAE study when we're looking at anxiety. And we can see here there's quite a significant effect. For instance, there's a significant difference in people who have anxiety in terms of age. So the younger age group, the 18 to 24, are extremely more anxious than the 45 plus age group in the UAE. The anxiety certainly is also related with and correlated with COVID-19. And it also shows that we have a relationship in terms of if you're COVID positive or negative and not tested. It's again leading to a greater amount of anxiety. And certainly if you have already mental health issues, well then again, there's a very much an increase and a much greater number of people that show anxiety issues than if you don't have already a mental health issue. This is then also reflected when we look at depression here in the UAE, where again the younger age group significantly more showing more depressive symptoms to the 45 age group plus. Again, similarly, if you're COVID-19 or not, much more depression, and then mental health problems. Again, here third down the line, again very much more people with depressive symptoms if already a mental health problem is in the person already. So again, we can see that the COVID-19 pandemic in the UAE, similar to other parts of the planet, has an effect on the population. This next slide here by Rega in 2020 just basically summarizes some of this. And Rega then says, well, is this a perfect storm? What's going on? And he mentions a number of issues. So we have some that I've already mentioned, such as economic stress, social isolation, decreased access to community and religious support. So much of this, I know some of the, religious services are now on Zoom, for instance. There's no personal contact with the clergy and with the other members of the religious community. We also find an increase in medical problems, and we are doing some work here again, sort of investigating this, in that people with mental health issues and or physical issues that could be, for instance, cancers or neurological issues, Parkinson's, multiple sclerosis, etc., tend not to sort of go to hospitals as much as they should for treatments, and hence sometimes their disease ends up progressing more than it would in other ways when there was much easier access and less stressful access to clinics and hospitals. So it tends to be then what we can call nearly a national anxiety that pervades the planet. And as a consequence of that, health anxiety. So everybody pretty much is anxious about their health, and many of us now certainly know people that have had COVID Some, unfortunately, have passed away, and many have had quite severe effects of COVID, where in some instances, and this is also important, is that the effects of COVID tend to, in mental health and neurological terms, stay for quite a substantial amount of time. And this is still something that we do not exactly know, because, well, the pandemic has been around now for a little bit over a year, so we really don't exactly know whether there are further repercussions of having had COVID-19, and the extent of that depending on the severity of the COVID-19 infections. So there are some solutions that are suggested by Riga. One is that you need to stay connected and maintain meaningful relationships in whichever way this happens, so by Zoom, MS Teams, etc. The UAE, for instance, has, I think I'll come back to that later on, implemented, for instance, telemental health. So telehealth per se and telemental health has certainly been increased, and it's been one of the solutions that the UAE has implemented very early on. Increased access to healthcare is certainly something that's been looked into. In terms of the mental health or telemental health, also distance-based suicide prevention has also been increased, so that people that have suicidal ideation have an easy path to be able to talk to people and to seek help. And then we have also media reporting, which I did mention can be a good thing, and maybe in some instances not so good. Okay, so what are we doing about all of this COVID-19 and in terms of the mental health issues? So this is from the Evidence for Policy and Practice Information and Coordination Center in Europe, called EPI. And I've looked at a number of these time spans that they provide on their website. So I've looked in on the 16th of June, on the 3rd of August 2020, and then again January 2021. And the thing that I'd like to highlight to you is just the size of these circles. And what you can see is that the circle here, or here the bar, for mental health, which is the last one, is indeed rather small compared to other studies that have been done, like for instance here, which is case reports. So there's lots of case reports, but not much on mental health. There's also a lot of studies being reported on health impacts and transmission as well, but the comparison to mental health is certainly that mental health is not getting the same type of attention than some other aspects of health in relation to COVID-19. So my perspective on that is that certainly more needs to be done in that particular area of health. So there's an article in Lancet by Holmes in 2020, multidisciplinary research priorities for COVID-19 pandemic. So he is actually saying a call for action in mental health. So one question is what comes after the COVID-19 pandemic? So if we get herd immunity or vaccinations work, or the virus just tends to disappear, well then what happens to the people that ended up being anxious and depressed during the COVID-19 pandemic? Will they find their way back to some stage of normality? So mechanisms, okay, need to be looked into. Coping strategies and preventative interventions start playing a big role in this, so that you can support vulnerable groups under the pandemic conditions and following the pandemic. So we need some methods for promoting more successful adherence to behavioral advice about COVID-19 while enabling mental well-being and minimizing distress. So successful adherence to behavioral advice. And then of course, we need long-term mental health strategies. My next slide shows some of the initiatives that have been looked into in Abu Dhabi. So they have set up a hotline to safeguard for mental health during the pandemic, and there's certainly SAHA has initiated a number of proactive solutions, providing psychological support. There are self-help booklets that have been distributed. There's active screening for symptoms of depression, anxiety, and stress. There is a lot of proactive counseling and medication available. Again, there's the telemental health initiative that I've mentioned before, and there's also a lot of follow-up care provided by the SAHA and the various healthcare services in the UAE. So there's certainly no lack of available resources that are provided in the Emirates. Now let's have a look and see now whether this is actually then addressing the demand. So we go to the next slide. 50.4% of this particular study undertaken by Luo and published in the Psychiatry Research Journal, 50.4% of these study participants access psychological resources through books or media. So they didn't go to a hospital or to a clinic. They access it through books. So these booklets that are being brought out, these information pamphlets that are being brought out, and the media that we have in the UAE, for instance, where you can listen to various aspects of this through the various radio stations, for instance, and TV stations. This is where a bulk of the population is obtaining their information and psychological resources from. And importantly, people with mild disturbances prefer to obtain such services, again, from media sources. This includes, smartphone apps and things like that. So this is the important aspect. So they prefer to obtain services from media sources. So a lot of where we're going to needs to address what the population is actually doing. So more hospitals may not be the right way in terms of addressing some aspects of the COVID-19 pandemic. Certainly hospitals and hospital beds are very important because of the increased numbers of people that require hospitalization. But in terms of addressing this, for instance, mild psychological distress, we may need to look into other areas. So when we look at the output of some of the research that inform responses to future pandemics, well, what are some of these requirements? So mechanisms, we need to come up with mechanisms, coping strategies, and preventative interventions. Mechanisms, how can we do this? We need to be prepared. So interventions need to be able to be delivered under pandemic conditions. So if you have, for instance, lockdowns where you can't get out and about, how are you going to be able to provide these interventions? And do you have a mechanism there already that can provide these interventions? Solution to the effect of repeated media consumption. Again, as I was saying before, this is a very important point that has been pointed out by Holmes, that media can be good, sometimes possibly not so good. So people need to be aware of what they can take away from various media sources. And in that regards, we need to be assured that there are authoritative sources available as well. And within that regards, for either, you need to make sure that you don't have overexposure of data coming out. how many people have, overnight been identified, how many people, what's the mortality rate, etc. And importantly, I find, is that we need methods for promoting more successful adherence to behavioral advice about COVID-19. So as we all know, we get lots of advice given to us. Wash your hands, wear a mask, social distances, do not go out unless it's necessary, stay away from crowded places. And as we all know, some people tend to adhere to this advice more so than others. And again, the question is, does this matter or not? And that's part of the research that we're undertaking. But certainly, it's always better to adhere to some of the advice that the health departments and the experts there provide us. So now moving into a slightly different tack now. So having identified that 50.4% of the population does things online basically, and very mild cases of anxiety and depression tend to again use media sources more so than any other sources. Well, then what is there around that can address this? So mental health, self-care, and the use of mobile apps is a way around it. So this then addresses these mechanisms about coping strategies and preventative interventions, but as I say, not only for vulnerable groups under the pandemic conditions. So that's the important bit. Not only, everybody ends up being better off trying to utilize preventative interventions and coping strategies. So you can read this up in a mental health publication, which was published for work on mental health in the United Arab Emirates by the Ministry of Health and Prevention. And what we find is that there's a limited attention on the self-management of mental illness outside of hospital settings. Now, this, of course, has changed, as I mentioned before, because we have this telemental health now, and pamphlets coming out that help people understand mental health better, physical health better, and what to do about it to maintain their mental and physical health. Here then I have some devices that you can utilize outside of hospital settings. There's a number of these. There's this Mind Lift, which is a type of meditation helper. And we have a number of others here. NeuroSky is something, again, that helps you meditate and provides calmness. This is another method here as well. So there's a number of these that are available. Some you need a computer with. Sometimes you just can do it through a phone or a tablet, as shown here. We did some work on this, and here we have one of our students, Habshi Khalif, did some work using the NeuroSky. And just a once-off usage of this NeuroSky for a number of minutes, trying to enhance meditation and therefore changing how your brain works, in essence, has shown that something that we call the stress index has actually decreased. So before doing this mental health relaxation exercise using NeuroSky, we had a stress index here, say, at around 2. And then after utilizing it, this for 10 minutes, the stress index went down to below 1, so to about 0.5. This is, by the way, not the result of Habshi's work, but this is more a summary mean average of the participants that we had attending. So certainly NeuroSky can help with relaxation, mindfulness, and decrease therefore in stress and anxiety. When you decrease anxiety, decrease stress, you're more likely to take on suggestions that are made in terms of promoting better health by following some of the recommendations that the health department comes up with. We did another study, a similar one, but using a different type of program. This is called hard math. You can run this on your tablet as well. And basically what we show here is that you can use this game here where the balloon rises if you're breathing at a particular frequency, which is called a resonant frequency, which is about 6 breaths per minute, so 5 seconds in, 5 seconds out. This makes then the balloon rise because the breathing frequency is in line then, which we can see here, with your heart rate. So as I breathe in, heart rate goes up. As I breathe out, heart rate goes down. Here I had a bit of a cough, but in general, heart rate follows respiratory rate. If that's the case, if it follows very closely, this balloon will travel along. That's what we call biofeedback. So you're getting some feedback about your physiological functioning. And hard maths, certainly research in the past has shown that it's certainly useful for many, many aspects of behavior. And here they list increase in focus, increase in sleep, increase in calmness, and importantly, a decrease in anxiety, decrease in fatigue, and decrease in depression if you use this particular app on a regular basis. I have another one called Inner Balance, for instance, that I can just clip on my earlobe here. It goes to my mobile phone and do this every day for 10-20 minutes. And I think it works nicely. It sort of calms me down for the day, allows me to concentrate a little bit better. And so I've been using that regularly, for instance. Okay, so what are we then doing at Khalifa University in terms of app development and utilization of apps? So there's been two main apps that we have come up with. There's also some that have already been in use for some time. There's one called Type of Mood that you can use. This can be downloadable from the Play Store, if you like, and in fact it picks up the mood from your typing rhythm on your smartphone. Now, when we then look into the COVID-19 perspective in particular, we can then also look at a number of other physiological or pathophysiological functions that we can investigate. So one of these I'll show you in a minute is this breathing sounds. And these breathing sounds change as the COVID-19 disease progresses. Now, this then is associated with an app that we've designed here with Dr. Hadjileontiadis from Biomedical Engineering. It's called CovidSense. And CovidSense is already available on the either through Android or through the iPhone. And I do end up having a recording here. So, okay, so you can see that as the lung tissue becomes worse, the changes in the sound patterns from the breathing also changes. And we're using here artificial intelligence then to learn to identify these sound patterns. As I said, this is then the CovidSense. This is what it looks like. It's available on Google Play or the Apple App Store. It collects data. So it collects self-reported symptoms. It collects the bioacoustic signals, including the breathing plus the coughing. It collects heart rate, which can also be then utilized to determine stress levels, anxiety levels, and then it also collects GPS data. Now, all of this is, of course, de-identified. So nobody, even though all the information goes to a cloud storage and it gets analyzed to improve the classification accuracy for identification of the virus, all of this is de-identified. But it certainly then allows a number of benefits, and I've listed them here. So what are the benefits of using this to the user? So we have the deep learning architectures, and it's this fusion amongst other spaces of meta-analysis and self-reported data and physiological signals that then provides you with a much more accurate classification and idea of risk of COVID-19. So the feedback then is that you can use this for self-managing health status and spatial distribution of high-risk places, and I'll show you that in a minute. And through this, through having all this data from CovidSense, you can also then link this to guidelines for call of action. So emergency calls, where's the nearest test center, first response action, etc., can all be linked to this CovidSense app. This is sort of shown here, where we end up just showing the distribution of various symptoms throughout here on this chart. And importantly, I should add, it also shows you the risk of COVID-19. So red, high risk, blue, low risk, in terms of the findings of the CovidSense, and it shows you the distribution. So it allows government and health authorities to bring in services where they are mostly needed. CovidSense has an ethics approval from the Department of Health, the National Department of Health. So this is just a reproduction of the letter that we have received. So this is for use within the UAE. Here I just show a number of the screens that we have for CovidSense. So it allows you to put in some of your own data. It records the heart rate here, beats per minute. It records your coughing test and your breathing sounds. It then provides statistics for you, and then you have this dashboard as well, where we can then add, if you wanted to provide hospitals and clinicians with information, this can, and it's not at the moment, but it can be linked to your Emirates ID, so that your data specifically then can go to health authorities, and you can then also, for instance, choose who this data goes to, so your personal physician, for instance. Now, the second app that we've developed here is about some intervention. So the first one, CovidSense, is important because it gives us a picture of the distribution of COVID-19 cases. It gives a personalized classification of risk of having COVID-19 to the user. It's also very important. And through the implementation of artificial intelligence, this system continues to become more accurate in terms of being able to determine the level of risk that the particular user is experiencing. So I would suggest everybody download the CovidSense and help us out in improving this particular mobile phone app. Now, CovidShield is slightly different. As I said, it's about the intervention. Now, what can we do then to reduce the likelihood, the risk of COVID-19? And in general, what can we do about the mental health in the population at large? So CovidShield is an app that tries to improve immune function and shields against COVID-19 via the use of these biofeedback games. So this is again partly what it looks like. So we have a game suite. So there's a number of these games that target physical and mental health in an unobtrusive, gamified, friendly and low-cost manner. Now, this is the next slide, shows you these games that we have here. So we've got this bubble game, we've got this jet ski game and a number of other games here. The aim of the games here is that it provides you with some incentive. You can see how well you're doing. And the whole idea of the game is that you can, which I'll show in a minute, you can use, and it promotes a particular breathing pattern. So you can set the difficulty level, so for level 1, level 2, so beginner to an expert. You can then set your breathing pattern, so 2 seconds in, 4 seconds out, or 2 seconds rest, 4 seconds in, 2 seconds rest, 4 seconds out. So you can set these different breathing patterns. The most commonly used one would be 5 seconds in, 5 seconds out, or you can, a lot of people do 4 seconds in, 6 seconds out. And you do this diaphragmatic breathing. And the diaphragmatic breathing is when you breathe in and your stomach kind of enlarges, and then as you breathe out, your stomach sort of shrinks again. This is what's known as diaphragmatic breathing. You've got to make sure that you're breathing through your nose and out through your mouth. And there's a couple of reasons for that. And doing this in this sequence, if you're following the sequence that you've set, say the 4 and 6, 4 seconds in, 6 seconds out, well then the score in your game goes up and things happen in your game. And I'll show this here a little bit better, where for instance the boat starts moving, or here in this glass globe you start activity, or you get this soap bubbles coming up into the air, dandelions, leaves floating through the air. So there's this candle becomes brighter here. So there's different types of games. These are the initial games that we've currently have developed, and certainly the whole team is working on, again, looking at different types of games as well to enhance the experience and motivate people to do it. And you can then compare, your results of the game with the rest of the family members. And in doing this, it promotes better health. That's been already known, that breathing at this particular frequency, as I said, resonant frequency, then leads to the activation of certain nerves in your body that improve the immune function and also brain function by reducing depressive or anxiety type of symptoms. So at the moment, CovidShield is not available on the App Store and Google Play, but we hope that this is going to be the case very shortly. So we're just working on this. Again, CovidShield has an Department of Health Ethics approval or IRB approval. We've developed for CovidSense and CovidShield a website. You can find that by doing a search. And now we're just waiting for the CovidShield to be able to be downloaded through the, as I said, the App Store or the Google Play. So what we're trying to then do in the future with these particular smartphone apps is to come up with reminders, so that a reminder automatically comes up on your phone, or it's time to do your breathing, or health professionals get a reminder about some of their patients that need to be doing something. I've discussed this before, that where we can have data access by health professionals either on a state level, if you like, throughout the Emirates through the Emirati ID, or where the user can specify, okay, I want my data only to go to this specific doctor. So these are issues that we're working on now, and then that we can also link this with other smart app solutions that are available. So there's lots of other apps, as you know, on the smartphones, heart rate apps, meditation apps, etc. So there may be then options where we can join this together. So the idea is that we hopefully, through the combination of CovidSense and CovidShield, that we end up having a global impact. Again, the impact is on a multi-scale approach. So we have these micro level of the user, we have a meso level, which is in the community, and then we have a macro level that leads to central authorities being able to take some action. And then research outcomes, well, a lot of that then depends on you, the public, sort of helping out, utilizing these apps like CovidSense and CovidShield so we can gain data and learn more about COVID-19 and its effects in mental and physical health. Okay, so that then brings me to the end of my presentation. I hope it was useful to you. This is my last slide. I like it. And what I've written here is, it's not what the object or process is, but the way we look at it that determines understanding and outcome. And I think we as a community are all looking at COVID-19 from different perspectives. That's the single user living somewhere in the UAE, to the universities, research centers, Department of Health, government. We're all looking to see that we all remain healthy and have a good quality of life. And the reason why I've got this particular image there is because this is known as the Horsehead Nebula, my favorite image, and we can only see what looks like, this is a gaseous nebula, it only looks like a horse's head from Earth. So if you were anywhere else in the universe, you would not see this particular nebulous cloud even reflecting a horse's head. So anyway, this is just one of my little reminders that be open-minded, try different things to help in mental and physical health. And of course, this is a traditional Arabic verse. Few know how much we must know in order to know how little we know. And this is certainly the case with COVID-19. So I thank everybody for listening in. If you have any questions, please just type them out on the chat option, and I'll get those and I will then respond through the university channels. Thank you very much.